Today we're putting two options head-to-head for high cholesterol. In one corner, you've got statins. Atorvastatin, simvastatin, rosuvastatin, the most prescribed class of medication in the Western world. The one your doctor probably handed you the moment your LDL came back high. The one roughly 200 million people worldwide take every single day. In the other corner, you've got ground flaxseed, a tiny brown seed you can buy for a few dollars at any grocery store, sitting right there on the shelf between the oatmeal and the chia seeds. Same condition, two completely different approaches. And today, I'm going to compare them round by round. Mechanism, side effects, cost, long-term outcomes, and accessibility, so you can see for yourself how they actually stack up. Before we get into the rounds, let me be completely upfront about two things. First, I am not a doctor. This is not medical advice. If your doctor prescribed a statin for you, there's a clinical reason. Do not stop taking it based on a video. What I'm doing here is putting published research side by side so you have a more complete picture. That's it. Second, statins are serious, well-studied medications that have saved lives. I'm not going to pretend otherwise. This is a fair comparison, not a hit job. I'm going to give both sides their full due and let the evidence speak. Now, let's quickly talk about what's actually happening inside your body when your cholesterol is high. Your liver produces cholesterol. Your body needs it for cell membranes, hormone production, and vitamin D synthesis. But when LDL cholesterol, the kind often called bad cholesterol, builds up in your bloodstream, it can deposit on the walls of your arteries. Over time, those deposits harden into plaques. The arteries narrow, blood flow decreases, and if a plaque ruptures, it can trigger a clot that causes a heart attack or stroke. That's the risk. The question is, what's the most effective way to lower that risk with the fewest downsides? Round 1. Mechanism. How does each option work inside your body? Let's start with statins. Statins work by inhibiting an enzyme in your liver called MgCoA reductase, the enzyme responsible for producing cholesterol. When you block that enzyme, your liver produces less cholesterol. Your blood levels of LDL drop. And to be fair, statins are remarkably effective at this specific job. Now, and depending on the type and dose, statins can reduce LDL cholesterol by 30 to 50%. That's significant. That's clinically meaningful. For people with established heart disease or very high cardiovascular risk, that reduction can be life-saving. I'm not going to pretend otherwise. But here's the limitation. Statins address one piece of a complex puzzle. They lower the number, the LDL number, on your blood panel. But cholesterol management isn't just about the number. Inflammation, oxidative stress, arterial flexibility, triglycerides, the ratio of LDL particle sizes, these all play a role in cardiovascular risk. A statin drives down LDL production. It doesn't address the inflammatory environment that makes LDL dangerous in the first place. Now let's look at flaxseed. But ground flaxseed contains 3 compounds that work together on cholesterol through multiple pathways. First, it's the richest plant source of alpha-linolenic acid, ALA, an omega-3 fatty acid that research has shown helps reduce inflammation in arterial walls. Second, it contains lignans, specifically secoisolaricyresinol diglucoside, or SASDG, which are powerful antioxidants that have been shown in animal studies to slow atherosclerotic plaque development. Third, it's packed with soluble fiber, which binds to bile acids in the gut. Your body uses cholesterol to make bile acids for digestion. When the fiber binds those bile acids and removes them through your stool, your liver has to pull more cholesterol from your bloodstream to make new ones. That naturally lowers circulating cholesterol, a 2015 study from St. Boniface Hospital and the University of Manitoba, a double-blind, randomized, placebo-controlled trial, the gold standard, tested 30 grams of milled flaxseed daily in patients with peripheral artery disease. After just 1 month, the flaxseed group showed a 15% reduction in LDL cholesterol compared to placebo. And here's the remarkable part. Patients who were already on statins and added flaxseed saw an additional 8.5% LDL reduction on top of what their medication was already doing. The placebo group on statins actually saw their LDL increase slightly over the same period. Round 1 verdict. I have to be honest here. For raw LDL lowering power, statins win this round. A 30 to 50% reduction is more than a 10 to 15% reduction. That's math, and I'm not going to pretend it isn't. But flaxseed earned serious points for addressing cholesterol through multiple mechanisms: inflammation, antioxidant protection, and bile acid binding, rather than just blocking one enzyme. And the fact that it enhances the effect of statins when used alongside them makes it a legitimate player in this space. I'll call this round a split. Statins take the edge for LDL reduction, specifically. But flaxseed's multi-pathway approach is something statins simply don't offer. Round 2. Side effects. This is where the comparison shifts dramatically. Statins, credit where it's due, are generally well tolerated by many people. Millions take them without noticeable problems. But a significant minority experience side effects that range from uncomfortable to serious. The most common complaint is muscle pain, myalgia. Those studies estimate that anywhere from 5 to 20% of statin users experience muscle-related symptoms. For some, it's a mild ache. For others, it's debilitating enough that they stop taking the medication. Beyond muscle pain, long-term statin use has been associated in large studies with increased risk of type 2 diabetes. A 2010 meta-analysis published in The Lancet, analyzing data from over 90,000 participants across 13 trials, found that statin therapy was associated with a 9% increased risk of developing diabetes. A 2019 study in the British Journal of Clinical Pharmacology found that statin users had higher rates of musculoskeletal disorders, liver dysfunction, cataracts, and fatigue. And there's the cognitive side. Some patients report memory issues or brain fog on statins, though the research on this is still debated. Now, flaxseed. The side effect profile of ground flaxseed is remarkably mild. The most commonly reported issues are digestive, bloating, gas, or loose stools, typically when people start with too high a dose without building up gradually. That's about it. However, and this is important, flaxseed is not without considerations. It has mild blood-thinning properties because of its omega-3 content. If you're on warfarin or other anticoagulants, you need to talk to your doctor before adding significant amounts of flaxseed. It can also affect estrogen levels because of its lignans, so women with hormone-sensitive conditions should consult their healthcare provider. And because of its high fiber content, it can affect the absorption of certain medications if taken at the same time, so spacing it away from other medications by at least 2 hours is generally recommended. Round 2 verdict goes to flaxseed. Statins carry a measurable risk of muscle pain, diabetes, liver issues, and other side effects that affect a meaningful percentage of users. Flaxseed side effects are primarily digestive and manageable with proper dosing. Round 3. Cost. A generic statin like atorvastatin costs roughly $10 to $30 per month with insurance in the United States. Without insurance, it can run $50 to $150, depending on the pharmacy and dosage. That's $120 to $360 per year with insurance. Potentially over $1,000 without. Yet a bag of ground flaxseed costs approximately $5 to $8 and lasts about a month at the studied dose of 30 grams per day. That's roughly $60 to $96 per year. Over 10 years, you're looking at $1,200 to $3,600 for a generic statin with insurance, significantly more without, versus $600 to $960 for flaxseed. And flaxseed requires no prescription, no doctor's visit to obtain, no insurance approval. Round 3 goes to flaxseed. The math is straightforward. Round 4. Long-term outcomes. This is the most important round, and the one where I need to be most careful with you. Statins have decades of long-term outcome data. Multiple large-scale trials, the 4S trial, the WASCOPS trial, the Jupiter trial, have demonstrated that statins reduce cardiovascular events and, in high-risk populations, reduce mortality. And this is not debatable. For people who have had a heart attack, who have established coronary artery disease, or who are at very high cardiovascular risk based on multiple factors, statins have proven life-saving benefits. That matters enormously. Flaxseed does not have equivalent long-term outcome data. There are no massive, multi-year trials showing that flaxseed reduces heart attacks or strokes the way statins have been shown to. The trials that exist show cholesterol reduction, blood pressure reduction, and anti-inflammatory effects, all of which are associated with cardiovascular benefit. But the direct outcome evidence isn't there yet at the same scale. However, the FlaxPad trial from the Canadian Centre for Agri-Food Research in Health and Medicine did show something important. In patients already taking statins, or adding flaxseed lowered LDL further and provided additional benefits that the medication alone was not achieving. The same research group also published data showing that flaxseed consumption produced one of the most potent antihypertensive effects ever observed in a dietary intervention, reducing systolic blood pressure by approximately 10 millimeters of mercury. High blood pressure is an independent risk factor for cardiovascular disease, so that finding is significant. And here's where the long-term picture gets more nuanced. Statins create a form of dependency. If you stop taking them, your cholesterol rises, often rapidly, sometimes higher than before you started, due to a rebound effect. You don't heal on a statin. You manage on one. Flaxseed works differently. The mechanisms: fiber-binding bile acids, omega-3s reducing inflammation, the lignans providing antioxidant protection, are cumulative and supportive. You're giving your body tools to regulate cholesterol naturally. That's not the same as suppressing an enzyme your liver needs. Round 4. I'm going to be straight with you. For proven reduction in hard cardiovascular events in high-risk patients, statins currently have the stronger evidence base. That's a fact I won't spin. But for people with mildly to moderately elevated cholesterol, for people who want to avoid medication if possible, or for people who want to enhance what their medication is already doing, flaxseed has compelling, published, peer-reviewed evidence supporting its use. I'll call this round a draw that leans toward statins for high-risk patients and toward flaxseed for everyone else. Round 5, accessibility. Statins require a doctor's visit, get a blood test, a diagnosis, a prescription, a pharmacy, and, in many countries, insurance or out-of-pocket payment. If you lose your insurance, if you miss your appointment, if your pharmacy is out of stock, you miss doses. Ground flaxseed is on a shelf at your grocery store right now, between the oatmeal and the chia seeds. No appointment, no prescription, no gatekeeping. You can buy it today, grind it if it isn't pre-ground, and start using it tonight. In any country, at any income level, without anyone's permission. Round 5 goes to flaxseed. Access matters. Simplicity matters. Empowerment matters. Let me read the scorecard. Round 1, mechanism. Split. Statins are stronger on raw LDL reduction. Flaxseed works through multiple pathways and enhances statins when combined. Round 2, side effects. Flaxseed wins. No contest. But round 3, cost. Flaxseed wins. Round 4, long-term outcomes. Split. Leaning statins for high-risk patients. Leaning flaxseed for mild to moderate cases. Round 5, accessibility. Flaxseed wins. That's 3 clear rounds for flaxseed. 2 splits. And I gave statins full credit in every single round. This wasn't rigged. It was just honest. Now let me give you the exact protocol. How to actually use this. The form that matters is ground flaxseed, also called milled flaxseed. Whole flax seeds pass through your digestive system largely undigested. The nutrients are locked inside the hard shell. You need them ground to access the ALA, the lignans, and the soluble fiber. You can buy pre-ground flaxseed or grind whole seeds in a coffee grinder. If you grind your own, but store the ground seeds in the refrigerator or freezer. The oils in flaxseed oxidize quickly once exposed to air. The dose used in the most significant clinical trials was 30 grams per day. That's roughly 2 tablespoons. Start with 1 tablespoon per day for the first week to let your digestive system adjust, then increase to 2 tablespoons in week 2. Timing. Morning is most common. Mix it into a smoothie, stir it into yogurt, sprinkle it on oatmeal, or blend it into a shake. The fiber works best when consumed with plenty of water, so drink a full glass alongside it. Don't cook flaxseed at high temperatures for extended periods. The ALA can degrade with sustained high heat. Adding it to warm foods after cooking is fine. Just don't bake it at 400 degrees for an hour. When to expect results? The street. The Boniface Hospital trial showed a 15% LDL reduction within 30 days. A 2012 meta-analysis in the American Journal of Clinical Nutrition found significant reductions with whole-ground flaxseed consumption, particularly in people with higher baseline cholesterol. Give it at least 4 to 6 weeks of consistent daily use before retesting your lipid panel. Where to get it? Any grocery store. Look for organic, cold milled flaxseed. A standard bag runs $5 to $8. Contraindications. Pay attention here. If you are on blood thinners, talk to your doctor. Flaxseed's omega-3 content has mild anticoagulant properties. If you are on diabetes medication, monitor your blood sugar. Flaxseed can lower blood glucose levels. If you are on medication for blood pressure, be aware that flaxseed may enhance the blood pressure lowering effect. If you have a bowel obstruction or inflammatory bowel disease, consult your doctor before adding high-fiber foods. If you take any oral medications, space flaxseed at least 2 hours away to avoid affecting absorption. The most common mistake people make: using whole seeds instead of ground, using flaxseed oil instead of the whole ground seed. The oil doesn't contain the fiber or lignans, or taking too little. The clinical dose is 30 grams, 2 tablespoons. A sprinkle on your toast isn't going to move the needle. Now, one more time, because I genuinely care about this part. I am not telling you to stop taking your statin. If you have a history of heart attack, if you have coronary artery disease, if your cardiologist put you on a statin for a clinical reason, that medication may be keeping you alive. Do not stop it because of a video. When what I am telling you is this: the evidence for ground flaxseed as a cholesterol-lowering, anti-inflammatory, cardiovascular supportive food is published, peer-reviewed, and significant. Whether you use it as a complement to your current medication, which the research suggests can produce additional benefits on top of what your statin is doing, or as a first-line approach for mild cholesterol elevation before resorting to pharmaceuticals, it deserves to be part of the conversation. Bring this to your next doctor's appointment. Show them the St. Boniface Hospital study. Show them the 2023 meta-analysis from the Journal of Complementary and Integrative Medicine. Have the conversation. That's all I'm asking. Your body doesn't have a statin deficiency. It has an inflammation and dietary fiber problem. And the answer might be sitting on a shelf at your grocery store for $6, waiting for you to notice it. If you know someone who's been on statins for years and has never heard about flaxseed, send them this video. That's how this information spreads, not through pharmaceutical reps, but through people like you sharing it with people they love. Take care of yourself. I'll see you in the next one.